Now we'll move on to social and economic behavioral interventions at the human and animal interface. This has become a very important topic for the APAR. In fact, one of the pillars of our alliance actually speaks about it. We have been struggling a lot to put this session together, thanks to our partner, ILRI, and also Ekta and Dr. Dieter for putting together a split people along with our African Union friends. I think it is moderated by Dr. Mayo, the Deputy Director General, none other than that, and with the years of experience on these matters. I request Dr. Mayo to lead the session. Over to you, sir.
Thank you so much, Dr. Rao. It is indeed my privilege and honor to be able to moderate this session today. I would like to thank the organizing committee for this opportunity to be the moderator on this session, which looks at social and behavioral interventions at the animal and human interface. This is a critical area to address when we really want to make effective changes. And thanks to Dieter and the team in the previous panel and session for raising some interesting issues on one, biosecurity. And I just want to reflect, Dr. Michelle talked about the work that they are actually doing with farmers on biosecurity measures at the farm level. He actually indicated that they are raising awareness and working with farmers, but they are seeing low adoption by farmers on some of these measures. He mentioned that he thinks that the issue of incentives and social cultural issues matter very much. So this further underlines that biosecurity at farm level needs to address socio-cultural factors at the disease control policy level. Gender and equity issues are also important. Therefore, this session will address the role of social and behavioral interventions at the farm level. We have 30 minutes ahead of us where we have an outstanding team of panelists. It is my pleasure this afternoon to introduce them to you. We have Dr. Nicoline, Haan, who is the director of the CGIAR Gender Platform and is based at the International Livestock Research Institute, ILRI. She's going to set the stage on this topic. She will be followed by 4 panelists who will share 5 minutes on reflections from their perspectives. These will be Dr. Salome Bukachi from the University of Nairobi, Dr. Gemma Chatters from the University of Liverpool, Dr. Annie McLloyd, a gender specialist and consultant on these matters. Last but not least, Professor Carl Rich, who is the Director, Master of International Agriculture, Oklahoma State University. So we have a very great team ahead, and I would like to welcome them all at this point, and I hope they are online and ready. So at this point, while we start this session, I would like to ask the panelists to post their questions or comments on the chat. If we have time, we will address them, but as we go, the panelists will also be responding. So without further delay, I would like to invite Dr. Nicoline to begin by setting the stage on this topic. And over to you, Nicoline. You have 10 minutes.
Thank you very much, Bonnie. I have a presentation, so let me see if I can share the screen for everyone. As we move forward. So again, thanks again for giving me this opportunity to present on an area that is very close to my heart, having worked on these issues for quite a long time. So I would like to talk basically about people, One Health, biosecurity, and what is the link. Presently, I am the director of the gender platform, the CGIAR gender platform, and gender basically stands for generating evidence and new directions for equitable results. So you will see that this is also reflected. But I am also an animal health sociology expert, having spent quite a lot of my life working with FAO on animal diseases. And you will see that part of that story is also reflected in what I present, because I will talk about avian influenza, which of course includes a lot of women. So I think there's a clear link there as we move forward. But let me first start off on a little bit of an idea, because I was also involved very much in the beginning of One Health, and was also, for instance, presented at the One Health, one of the first One Health meetings in Melbourne in 2011. And so I've always been very engaged in the whole idea of One Health. And for me, the big thing was always about, you know, what are the trade-offs for people in the middle? Often we talk about mind health being quite institutional, and I see Michelle also mentioned that in the chat. But I also see it as what are the choices people make, and how can we change those choices people make so that it does become a One Health, and that we do have better food system, better healthy people across the world. So for me, that's really part of the center point. And I really do want to express this quite strongly, because I think often we get sort of lost in this institutional thing about, you know, well, people, yes, they're there, but they're not really seen as agents in this system. And I'm going to show you some examples of how we can look at people as agents in this system. So first of all, so where does this interface happen? And it is very complex, no doubt about it. I mean, there's an impact of the disease that is determined by all sorts of things, and you'll see that here, and determines also all sorts of things. So, I mean, social stability, for instance, can be impacted by a disease, as we've seen with COVID, as we move forward. But we also see that there are certain influences that will happen on the disease about how we act. So people get acted upon by a disease and issues, but also how we act moves also will influence how the disease presents itself, what happens, etc. And on a bigger level, I do want to talk about two quick ones, which is intensification, deforestation, and globalization, and of course, climate change, which is all human based. So I think these are very important that we understand our role in these things as they're happening. We know that with Ebola, intensification and deforestation were one of the main reasons. We also know that with avian influenza, globalization, it was a lot of day-old chicks that were being moved across the world that actually brought the disease. Even here in Kenya in 2007, it was rumored that it was day-old chicks from Egypt that were bringing in the disease. So we know these things are important, and we know that we need to keep an eye on them as we move forward. So I just wanted to talk about, you know, who are these people in it? And so I think there are three levels, especially when we're talking about biosecurity and how we actually deal with biosecurity. There are three levels that we really need to be looking at. So one is the national level, the community level, and the household / individual level. And I think when we talk about biosecurity, those are exactly partners that we really need to understand at all levels. So one of the examples of biosecurity at national level is restricting of movement. It's one of the first things most people do. It's one of the first things that in most diseases we say, we can't move animals. But what we noticed with Rift Valley fever, for instance, in Kenya, with one of the outbreaks, is that we said, nope, they can't move. What did they do? They moved them at night when nobody was around. And so in the process, we're still spreading the disease. So it's the people that were moving. It wasn't the disease that was moving. It was the people that were moving the animals. Then the other one that's on community level, one of the first things we often also do is cull. We decide that, well, we need to get rid of this disease, so we will cull. I see recently, I think I think it was Hong Kong or so, they were killing all these cavias because cavias have COVID. That's our quick and first reaction. But what happens is when you start culling, somebody who has to report it. And if somebody's reporting it in the community, then people will say, well, you're reporting it, and they're culling it, I'm losing my animals, so next time I'm not reporting. So again, when you're talking about reporting or surveillance, which is also very important, you really need to understand the incentives, why people would report or not, and really understand some of those. Culling, for instance, also was happening in Cambodia with avian influenza. Overnight, all the animals would go to Vietnam. and just stay in Vietnam until the culling was over and then come back. So again, one of those moments where it's the human behavior that's spreading this disease, us not understanding the incentives and not setting up systems, social systems that allow this to happen. Biosecurity, as Michelle also discussed, is very much also at household level. We always talk about, we need to make sure that these farms are very biosecure. But as you also mentioned, it's often not much uptake. Well, why? Because labor, usually all the things we're telling people to do require extra labor. Either you need to wash your feet more often, or you need to build a whole fence, or the animals are not allowed to go out and feed. All these things cause labor. And so that's one of the main reasons people often don't do them. And especially when the impact might be okay, but not that great. We all think that the impact will be great, but in a lot of these systems that we are working on, they're smallholder systems. So they don't have one animal, they have several different types. Now, the other group I do want to talk about a little bit, and this is where the women come in, is I do think we need to include women much more in some of this biosecurity and understanding how we're working it, because they are a big part of the system, and they are important in surveillance. They are often the caretakers, and will see what's happening, but they often don't have a lot of access to resources to help them. So I think this is very important to understand. And in that, I want to give a quick example of gender and vaccine, where we are looking at some of these issues. And for instance, that we do know that gender tradition in general allow women to access animals very often. And so the identification of diseases is gendered, who actually sees it first. But so are the ownership. If you own an animal, or if your husband owns it, are you going to actually be willing to pay for vaccinations? Interestingly enough, we did a research on the willingness to pay for vaccines on Rift Valley, I think it was Rift Valley fever. And it was interesting because in certain societies it was, and in certain sizes it wasn't. These are some other examples of what we're actually working on as well, looking at the gender issue in those areas. This is just a quick, again, Rift Valley fever, to understand the inter-household decision-making on when they actually do vaccinate. And one of the interesting things was it depends on who actually bought the animal, but it also depends that once the animal is bought, a woman might tell her husband that she's vaccinating. It's not because she's actually asking for permission, but she is sort of telling him, can you also fund part of it? So I think those are some of those interesting things. At that level, there are certain implications. So we need to understand the trade-off incentives, the trade-offs and incentives, sorry, apologies. The context, understanding the context in which people make them, I think that's also important, and understanding the political and social economy. Let me just quickly go through a case study with avian influenza and everybody thinks, well, why are we still talking about avian influenza? But if you look at it, it's still there, it's still working. And part of it, in my opinion, is that we still haven't figured out the human element. We really haven't gotten people behind it. So one of the things we did while I was working with FAO as well, looking at how these are the clades, they're moving from H5N1, and they were moving. So why were they moving? And so that's when we really started looking at value chains and risk analysis, because we felt that this was a point where we could develop risk managers. How are there some people who we can actually touch and make sure that they actually make sure that the whole value chain becomes more biosecure. So we did a whole research on looking at where are these people, what are the incentives, what are the flows, how can we actually do some risk management, as you see on the right, where can we actually influence it? And so figuring out the hotspots in value chains so that the disease does not spread further. And see, these are just some of the maps that you can see. So what happens then in these value chains is you'll see that very much, like I've talked about, that the production and the consumption, the production and consumption is where the animal moves. And again, that means the disease is moving. And we need to understand, including the local trade, including the cultural trade, those issues will help in us understanding biosecurity. So we need to start understanding the risk profiles of all these people. And this is just some work just to show how can we actually access them and how can we influence them. It's useful, but it also adds values to the value chain. It makes the value chain more safe. And so I think it is important that we look at issues and systems such as this. So again, an opportunity, how people make decisions will influence biosecurity measures. We need to understand the trade-offs and the incentives. We need to understand the context in which people will make them. And we need to understand the political and social economy. Empowering these people actually helps us make a healthy food system. So I just wanted to end with a little bit of a thinking about what can we actually do? What can we do as we walk away from here? We need to acknowledge that people and their decisions are important in One Health, and we need to really start integrating people and their decisions in our projects. We need to research these issues, and we need to implement and be intentional about them. But my last plea is as important is that collaboration between the social sciences and the human and health researchers, human and animal health researchers, because we need to figure out what are the technical parts that we can then actually influence the behavior. With avian influenzas, I was shocked at how little is known often of the technical understanding of how a virus moves. And I think is the same with COVID. COVID, we've spent a lot of time on, for instance, vaccines, but we still don't understand how long does the virus actually exist outside. This is important for people like us who are social scientists, because then we can actually really give good advice and really figure out mechanisms whereby we can get people on board and get the right incentives as we move forward. This is just a little bit of a background. I thank you for your attention. And I know that my fellow colleagues on the panel will also have wonderful experiences to share.
Well, thank you so much, Nicoline, for that and for wearing that social scientist hat and bringing out the reminder that what do people really need, and help, reminding us that it's important to be inclusive, to understand what they really need, and reminding us that it is about people in this complexity, that it is about people, so their needs are important. We have the team that is also going to add other perspectives. The next 5 minutes, we'll come back during, if we have time, but let's try and go through the rest. We have Dr. Salome Bukachi from the University of Nairobi. Doctor, you have 5 minutes to reflect on this topic of social and behavioral interventions at animal and human interface. Over to you.
Dr. Siboniso, may
Yes.
I interrupt 1 second? I apologize for the interruption. We are significantly running behind time. So it would be really kind of all of the speakers to be as tightly managed with time as possible. My apologies for the interruption. Thank you so much.
Thank you for that. Dr. Salome, if you could just reduce your 5 minutes to 4. Let's see how we go. Over.
All right. Thank you very much. And thank you, Nicoline, for setting that stage for the social and behavioral aspects. I would just like to concur with something that Nicoline has said, that when you look at the aspects of interventions, we need to take into consideration the social, the cultural, the historical, and the political contexts, because these have great implications in terms of how our interventions work. For example, the aspect of the extra labor. Sometimes we have an example of what we had a vaccination program, and we asked the farmers to bring their sheep and goats for vaccination, but we were not finding quite a good turnout. When we now started investigating further, we realized that it was the aspects of labor. It was only the women at home, and maybe the elderly women, the children have gone to school. So the people who would bring these animals to the vaccination point were not there. So sometimes we may say that communities are not responding to the interventions that we have put in place, but it is because sometimes, or many times, we forget that there are social, cultural, historical, and political contexts that we need to take into consideration. So some of the things that I see that sometimes make some of the interventions we have in relation to biosecurity not take place is that knowledge, the community's knowledge in relation to those, the diseases and the biosecurity aspects may be limited. The other thing could be that the community's perceptions of risk. I have worked on Rift Valley fever, trypanosomiasis, and brucellosis. And one of the things we keep seeing is that communities' perception of risk is not the same as how we look at it. And so this we are telling communities to take into consideration and intervention, but we have not taken time to understand how do community think? What are their cultural logics behind knowledge about the disease occurrence, transmission, and even how it can be managed? So those are important issues that we need to take into consideration and incorporate these social cultural, the gender aspects in the responses, and not just as an afterthought, but to ingrain this in our processes as we start from the beginning. And also to realize that behavior change takes time. And so this needs longer time. Many times in some of the programs we have or the research projects we have, they're very short, and we expect that within that short time, we have been able to change people's behavior in relation to their perspectives about biosecurity. But we need to take note that behavior change is a long-term process. And so if we want to work with the communities, then we need to be able to commit time to be able to bring about the changes that take place. A key thing is that one size does not fit all. We have interventions, we think that we need to have these interventions in place, but because we are taking interventions which worked in a particular place and not adapting them to a particular environment, then sometimes we find that adoption levels become low. So we need to also tap into communities' knowledge. Community also have indigenous knowledge in relation to how they manage some of these diseases. And so it's important to tap into communities' indigenous ethnobotany knowledge, and also the community resources to help also improve on the community surveillance system, so that community can also assist and strengthen the surveillance system. And then also we need to rethink how we work among various stakeholders and disciplines, so that I think one of the presenters had mentioned that the equity aspect has to be there, not just between us and communities, but also between the disciplines, that becomes an important thing for us to take into consideration. So I rest my case there. More can come in the discussions. Thank you.
Thank you so much, Dr. Salome, for that. We will come back if we have time, and we can post the notes later. So I'll move on now to Dr. Gemma. Dr. Gemma, your quick intervention. I'm sorry, we'll have to cut everyone to like 3 minutes. Over to you.
Okay, hi. So thank you very much for having me. I'm here from the Global Burden of Animal Diseases project, which aims to quantify the losses in livestock systems and attribute these to disease, and provide a tool so that the livestock keeper, public and private sector and government can decide where best to target resources for most efficient return on interventions to improve livestock health. So I must just say that I agree with everything that Dr. Haan and Bukachi have said so far in this session. But some of the, so my background is in disease transmission in Tanzania, really, and focused on livestock movements and disease transmission. And what I think that we, although this is about emerging zoonoses and emerging threats, and what I really think that we need to be doing now is focusing on what we do know about, which are endemic pathogens, and trying to set up a surveillance system that can actively work with livestock keepers and across governments to have a surveillance system in place that targets, that looks for endemic diseases, endemic pathogens, endemic zoonoses. And because for these we have diagnostics that we know work, treatments and vaccinations that we know work. And if we can set up a platform that, say, for example, piggybacking on the back of the mobile phone network that has extensive global coverage, and we have two-way communication with people who are reporting disease or syndromic surveillance, and they can get feedback and positive returns and incentives such as vaccination provided when they've identified disease. Then we can get a platform that's robust and then able to detect any changes when new or emerging pathogens appear. A couple of other things that I'd like to just point out. We know that livestock movements can provide routes for pathogen transmission. So I think that we can use data that we have on livestock movements to identify key locations for pathogen surveillance. for active surveillance, and we can also have passive surveillance at a livestock keeper level. And if we start to engage across government sectors and use data that we have, so existing, although there are many, many gaps in the data that we have from across Africa, we do know things like, for example, in Tanzania, when there are increased levels of abortion experienced in the livestock at the household level, less money is being spent on education. So if we can engage across government sectors and say, look, improved livestock health can improve societal good, can improve expenditure on education, then we need investment to help support these livestock keepers. But where is that going to come from? It needs to be cross-cutting, and try and show the benefits that we'd have from improved livestock health. Another quick point I'd like to make is that through increased syndromic surveillance in Tanzania, we were able to pick up a Rift Valley fever outbreak in small ruminants that was causing abortion, again in small ruminants, and detect that before it was reported before any cases were reported in people. So again, that's an example of that we can show to government and to public health officials and say, increasing your expenditure in livestock health, in surveillance in the livestock population, can have a public good. And yeah, I guess I'll stop there and let everybody else keep their 3 or 4 minutes.
Thank you so much. Thank you for that. We'll move on, and I hope you can post the notes later. Dr. Haan McLloyd, if you're online.
Yes, I'm online. I hope you can hear me. My previous speakers and panelists have been so good that there's nothing left for me to do, but I have 3 minutes, so I'll try and use them. And I should tell you that
You might use 2 minutes.
Yeah, I'm an economist, but I've been converted to qualitative data because it's all very well to draw a curve on a graph, but the really important thing is what drove the shape of that curve. So I think maybe just a couple of points to add. The first one, and this is a really important point that's been made by several people, is around trade-offs. And I have noticed that almost every time we try to increase biosecurity in a livestock value chain, we probably create a benefit for urban consumers because we make their food safer. But we very often make it extremely difficult for small scale producers at the beginning of the chain. And so I would urge everybody who's looking at biosecurity and livestock value chains to look at the impacts along the whole chain. There's usually a way of dealing with the trade-offs, but you have to think about them early on to be able to do that. Another point is that I think a lot of what we're talking about here is the importance of having a really deep understanding of the nuance and context in which One Health work is being done. And that means a lot of feet on the ground and a lot of qualitative data, which is not easy always to get. And it can be quite scary for biological researchers who are mostly used to dealing with numbers and quantitative data, but it can be so important. I used to work with Nicoline in FAO when we were looking at bird flu. So just to pick out one example, to make a live animal and live bird markets safer, it's a really good idea to have water available so that people can wash their hands and then the birds don't spread disease so much to the humans. But if your immediate solution is to put in tap water, you might want to consider who's been bringing the water beforehand. If there were water carriers involved in bringing the water beforehand, you may put them all out of business in about a week. So you create an enormous biosecurity benefit to one group and a disbenefit to another group. I could come up with 20 other examples, but in the interest of time, I'm going to stop here and hand over to the next panelist.
Thank you very much. Professor Carl, Carl Rich, if you could close for us in 2 minutes, would really appreciate that.
Sure, thanks so much. I'll see what I can do in terms of time. I mean, as Annie mentioned, I think most of the speakers have really kind of brought the key points. I think, I've heard all of the sort of the relevant sort of buzzwords or really kind of key kind of concepts, the issues of trade-offs, looking at local context. I want to kind of bring in a few points, so to maybe just kind of add on to some of the discussion. One, and Nicoline mentioned this at the end of her talk, and maybe didn't focus on it as much as we need to, is sort of the issue of empowerment. How do we empower agents within these systems? I think one of the things, one of my main kind of takeaways from the discussion is we've done a much better job over the past 10, 15 years, starting with bird flu and kind of moving forward, kind of understanding the what in terms of what do we actually see, what do we actually need to understand. What we're not doing as good of a job is how. So what next? How do we intervene? How do we get data? Annie mentioned this in her comments, and I agree wholeheartedly. How do we actually get information to support interventions? How do we develop awareness? How do we understand context? And so I think one of the things that we need to start thinking a bit more of is what are some of those important hows? How do we actually kind of intervene effectively so that we can actually sustain the types of interventions that we're trying to move forward? I don't have all the answers on this. Although my current work looking at the role that participatory processes play in empowering communities and empowering groups to kind of work together and kind of build common models to learn together, to work together towards common goals might be one way forward. And so I think as we're trying to understand these types of issues more and more, thinking about the how in addition to the what's going to be critical. So I'll stop there.
Thank you so much, Prof. I think that was a good way to close our session. I don't even have an extra minute. So just to say thank you to our panelists and hope these notes can be available to the participants and everyone. Thank you. Back to Dr. K. Over.
So thank you so much. What a rich session. Very, very impressive. And I would have loved to hear more. And it's very unfortunate that time is so limited.